My name is Kristen Kremer. I'm an assistant professor of social work at K-State University. Today, I will be discussing mental health services for rural youth and the barriers that they face. 25% of American youth experience mental illness each year. Among justice-involved youth, that number is much higher. Research has found that roughly 2/3 of youth in detention or correctional facilities have at least one diagnosable mental health condition. This includes 76% of offenders who have substance use disorder, 33% with high anxiety, 12% with depression, and 12% with PTSD. Access to mental health services is already limited for justice-involved youth, and it's particularly challenging for those in rural areas. Rural communities struggle with receiving mental health services due to three primary reasons. The first is accessibility. The second is availability. And the third is acceptability. Accessibility refers to physical access to services. In rural areas, this means the long distances residents oftentimes have to travel to receive mental health care. But traveling long distances on a weekly basis isn't always possible, and providers are oftentimes forced to reduce quality or quantity of services. This means that instead of weekly appointments, as would be the case for urban areas, rural youth may receive in-person services only once a month, with supplemental services provided through telehealth. Telehealth is just not the same as in-person care. Individuals in rural areas are also less likely to be insured for mental health services. In fact, youth in Kansas's 15th Judicial District are significantly less likely to have health insurance than youth in other parts of the state. This means that families must pay out of pocket for mental health care. Availability refers to the chronic shortages of mental health professionals in rural areas. Across Kansas's 15th Judicial District, the number of licensed masters of social workers and licensed psychologists is less than 10 total. For some rural counties, this translates into no licensed mental health providers for the entire county. Instead, more than 65% of rural Americans receive mental health care from their primary care physician. Primary care physicians receive some training in managing medication for more common mental illness such as anxiety and depression, but their limited training and limited time prevents them from managing more complex mental illness such as bipolar disorder and PTSD. They're also unable to provide therapy for the trauma that is underlying a lot of these youth mental health problems. As a result, mental illness goes untreated, and the top responder for mental health crises in rural areas tends to be the law enforcement officer. Acceptability of mental health services refers to individuals being accepting of and open to receiving mental health services. Part of this acceptance refers to the continued stigma against needing or receiving mental health care. This stigma exists across the state, yet it's more pronounced in rural areas. Additionally, given the intimacy of rural communities, anonymity and privacy are really challenging. A mental health provider may be a friend, a family member, an acquaintance, and individuals might refrain from seeking services due to the embarrassment and discomfort of receiving help from someone you know. Even if individuals are open to receiving help, the lack of providers and treatment options results in services that are quite frankly unacceptable to some rural residents. The problem is that mental health providers use a one-size-fits-all approach. They assume providing services to rural communities is no different from urban communities, and they don't receive the necessary training and cultural competence in working with rural populations. As a result, rural communities might not be accepting of the services that are available. To address these barriers in mental health care in rural areas, several measures can be taken. First, we can have better integration of primary care and mental health services. This may include having mental health providers physically located in primary care physician offices. making a one-stop shop for everything related to health. Some people don't like going to a mental health clinic because of embarrassment, but they won't be worried about having someone watch them walk into their primary care physician's office. Further education to the community on the prevalence of mental illness and its consequences may also reduce its associated stigma. We also need more training to mental health providers on cultural competence for rural areas. Licensed mental health providers are required to complete continuing education courses each year. Having a course targeted on rural care might be an effective way to offer this education. Finally, the shortage of mental health providers in rural areas is disgraceful, and further efforts by state and local areas to incentivize and encourage mental health workers to serve rural communities is needed.